Hey guys, Dr. Clint Steele here, Leading Edge Chiropractic. I want to share with you in this video real quick how to fight off a cold naturally. Now, first off, causes of colds are not germs. Germs do not cause colds. Germs do not cause sickness. The host that's hosting those germs is what allows the germs to cause infections, cause problems. In other words, guys, germs are all over us. Germs are all around, everywhere. If you go into a room, you meet someone, you greet them, you shake their hand, you give them a hug, they have a cold. 5 people can do the same thing with that person. One of them has a cold the next day, 4 of them have nothing. Why is that? It's not the germs, guys. There's germs around us all the time. What happens is the germs have an opportunity to create, germs are opportunistic, so they have an opportunity to create problems if the host, in other words, if your body is not working like it's supposed to. So if you're depressed, your nervous system is depressed, your immune system is depressed, you have too much stress going on in your life, you're not eating properly, you're not drinking enough water, you're not getting enough rest. Those are the types of things that allow germs then to create problems. But the germs are all around us, guys, and the germs don't cause problems until the host allows the germs to create problems. I hope that makes sense to you. It may be totally different than what you've learned, totally different than what you believe, but again, the germ theory of disease has been disproved time and time again since it first came out in, I think, in the 1800s, guys. So I'm going to give you some options here in a minute. First, I want to share with you some of the symptoms, obviously, of colds. Now, there's a saying that the symptom is the cure, okay? And what that is actually true when it comes to colds is that, guys, when you're sneezing, your body's trying to get rid of, you got junk coming out of your nose, your body's trying to get rid of this, okay? Same thing when you're coughing, you get bronchitis, you get something, like your body's trying to get rid of this stuff, excrete this stuff somehow. And so those are the symptoms that you get. You get the sinusitis, you get the running of the nose, you get the coughing, you get the sore throat. What happens? You get swelling of the throat because the body's trying to send more blood to that area to fight off the infection, fight off the bacteria. And so those are some of the symptoms that you get, and that includes stuff like sinusitis, sinus infections. When there's too much junk in there, it can't get rid of it, it becomes infected. Same thing with ear infections, guys. When there's too much junk, your body produces the stuff to try to fight it off, and it gets built up, and when it can't get released, that's when you start to get ear infections and sinus infections. You start to get the junk that's in your throat that you need to cough up. It gets added into the lungs, and it just doesn't have a chance to get out. And so that's what produces that stuff. So you want to make sure that you decrease dairy. Okay, number one, you want to decrease dairy because dairy helps produce that phlegm, and so you don't want more of that phlegm. Increase your water intake, guys. You want more water going through your body so your body can excrete this stuff and get rid of it. Make sure you get enough rest. Make sure you're eating properly, guys. That means no sugar. A lot of times it means trying to stay away from gluten, especially. A lot of people are sensitive to gluten. That's going to cause more problems. Guys, over-the-counter stuff as well. What you're doing when you're taking over-the-counter stuff is you're just allowing more chemicals to come into your body, more stuff your body has to fight off. And in my experience, in 23 years of not only personal experience with colds, but in my patients, is it usually extends the life of the cold or the life of the symptoms, the length of the symptoms. So you don't want to be doing that stuff. Solutions. So bad solutions, again, guys, you can take antibiotics. A lot of people right now, they run to their medical doctors getting antibiotics for ear infections or sinus infections. And this is what this is doing, is it's killing off the bacteria, absolutely. But in addition, when you take the antibiotic, it doesn't go to your ears, it just doesn't go to your sinuses, it just doesn't go to your chest. It goes all over your entire body. So when it fights off that bad bacteria, it also fights off good bacteria. It kills off good bacteria that you need, like in the lining of your gut. That's so important. So when you kill this stuff off, guys, there's a whole process that you need to take in order to reintroduce good bacteria into your gut, into your digestive tract. Antibiotics, also regular use of antibiotics is also shown in, and guys, this is medical research showing this, increases your risk of irritable bowel syndrome because you're changing the flora in your intestinal lining. Increases your chance for asthma, increases your risk of having another infection. So ear infections, kids that come in with ear infections, they go on antibiotic, almost always within 6 months they have another ear infection, another infection, another ear infection. Then eventually the antibiotics can't kill that off, so they end up putting tubes in the ears. Guys, these are the types of, this is one path that you can go down. You can take stuff over the counter. It's going to extend the length of the cold. Again, 23 years of experience, guys. I've seen this time and time again. So you can go down this path or you can go down this path. This other path here is this. Take care of yourself, okay? Make sure you're drinking enough water. Make sure you're decreasing dairy, or I would cut it out entirely if you have cold symptoms coming on. Increase your vitamin C intake. You want to make sure you're getting adjusted regularly. Guys, research shows that regular adjustments, people that are getting adjusted regularly on a regular basis, have an immune system 200% greater than those that don't get adjusted regularly. In addition, research shows that after an adjustment, within 20 minutes following an adjustment, your white blood cell count, white blood cells are the cells in your blood that fight off disease, your white blood cell count increases by 20%, 20 minutes after having an adjustment. So get adjusted regularly. You're going to want to get some garlic, guys, either garlic oil or garlic bulbs that you keep in your fridge. You just keep them. And what you want to do is with that garlic is you boil some in some water. If you're having a sinus infection or a chest infection, or you notice something coming on, you want to breathe those vapors, okay? As that steam comes up off the water, you want to breathe it in through your nose and through your mouth, maybe 5 minutes, 3 or 4 times a day. Guys, garlic is the best natural antibiotic you're ever going to find. I have people coming in here that have been on antibiotics for 2 or 3 or 4 days. You know, they still have their cold, they still have their bronchitis, whatever. I'll tell them to do garlic. Next day, boom, it's gone. It happens on a regular basis, guys. People that use or do what I say with the garlic, it works wonders. If you're having a sinus infection, again, breathe through the nose. You can also put some garlic. If you put it in, if you have garlic oil, I would put it right in there. Put it on your chest. Put it here in your ear, around your ears. You can put it into your ear with an eyedropper. You know, warm it up a little bit. Put it in there. Hold it for like maybe 30, 40 seconds, and then tilt your ear up. Take the excess out. It's going to get right into the eustachian tube, and it's going to allow that natural antibiotic to kill off the bacteria. Essential oils are great as well. Eucalyptus, frankincense. What I would do is recommend a carrier oil. Put it in like, I prefer coconut oil. Put that right on your sinuses. Put it around your ears. Put it on your chest if you're having chest congestion. If you're having sore throat or strep throat, you're susceptible to strep throat, you put some garlic, that garlic that you just boiled in water, let it cool off a little bit, and then gargle with it. Works wonders, guys, wonders. So those are some of the things that you can do. Again, taking care of yourself, though, you're the host of these germs. Keep your body functioning the way it's supposed to. Okay, eating properly, proper rest, decrease stress, make sure you get enough water. Those are the types of things that you can do on a regular basis, guys, to prevent the colds. If you notice colds are coming on, though, get adjusted, get your garlic, and then get some essential oils. Now, there's some other things too. Echinacea works well. Different herbs work well as well. So those are the two paths, guys. You got this path here that you can take the antibiotic. It's going to depress your immune system. That's the other thing, guys, with antibiotics. You take the antibiotic, if it fights off the bacteria for you. You don't have to do that, which may sound like a great thing, but what it's doing is depressing your immune system. So especially in kids that are getting antibiotics for ear infections on a regular basis or even one time, especially guys, newborns, kids, their body has to experience what's going on with these germs so that their body can develop a defense system for them. Otherwise, what's going to happen next time that comes around, boom, they're going to get it again, and they're going to go on antibiotics. It decreases the immune system, and that's why kids at a young age, get their tonsils pulled because they're regularly getting strep throat. They're getting tubes in their ears because they're regularly getting ear infections, because the parents go in, they get the antibiotics, they don't take care of the root cause, guys. The root cause is your body, your environment, taking care of your body, boosting the immune system, taking care of this stuff on its own, allowing the nervous system and the immune system to fight this stuff off. And so what happens is you're constantly then becoming dependent on more antibiotics, more antibiotics, more antibiotics. And then when that doesn't work, then you got tubes, you got tonsils that are coming out. That tonsils help boost the immune system as well. So, you know, before people were saying, well, you don't really need your tonsils, so let's just take them. Guys, that's not the case. Okay, this is disproved years and years ago. Yet people are still going in and removing tonsils because they think that's the problem. Guys, you don't have ear infections because you have ears. You don't have tonsillitis because you have tonsils. All this stuff is happening because your body is not functioning the way it's supposed to. That's the root cause of colds. That's the root cause of bacteria causing symptoms. So I've gone on long enough. That's the road. You guys can go down this road. You can go down this road here, getting adjusted regularly, taking care of this stuff, allowing for your immune system to fight this stuff off, boosting your immune system. Essential oils, garlic works wonders. Go out and get some garlic, have that in, get some essential oils, get adjusted regularly. Boom, we're done. All right, guys, have a great day. It's Dr. Clint Steele.